Hi, good morning everyone. My name is Dr. Daniel Chua from the Refractive Surgery Department at SNEC here. So today I'll be talking about working from home and the impact and what we can do about it. Just let me share screen. Okay. Sorry. Okay, so firstly, working from home, as we have been very familiar for the past few months, has caused a lot of symptoms such as blurred vision, dry eyes, or strain on the eyes. And a lot of patients also complain of redness, fatigue, and heaviness. And this kind of cluster of symptoms can be termed as kind of digital eye strain from the increased usage of digital devices. So a lot of us will probably be working from home either on our favorite couch, maybe on a dinner table, on a favorite chair. But the main point is that it's not something which is similar to what we are more familiar with in the office environment, where we have a bigger screen, or we are able to sit on a nice chair or our regular tables. So as I mentioned, the conditions are kind of different. Some of us at home, we may have a very good setup where we have an extra monitor and a good table, or we may be even going for like a dual monitor setup, bigger screens where we can kind of increase the font size to help us, or we can go overboard for some of us. But like what I mentioned, most of us will be probably kind of hunched over our small little laptops, 14, 15-inch screen on our dinner table. So, of course, the first point is to optimize the working conditions that we are kind of stuck with. And the ergonomics is very important to kind of reduce the strain. Where possible, I would recommend having a larger monitor or increasing the laptop screen. And also changing the conditions of the screen per se, such as adjusting the contrast or the brightness. Using a matte screen filter, this may also reduce the strain that you get. And of course, having a good posture so that you can work for longer hours. The lighting is also important, because if we are kind of working in inappropriate lighting where it's too dim, or the lights is just overhead, causing reflection into your eyes, it will kind of increase the fatigue that you may experience after working for a duration of time. I think one of the common questions that I think my previous colleague also mentioned is that the use of blue light glasses and whether does it really help. I think it has been shown that ultraviolet light or excessive blue light exposure can cause eye problems such as cataract. But to be honest, the amount of light or blue light from digital devices that we are exposed to has not been shown to cause any eye problems. But I think it is more related to how digital devices are used. And in terms of poor lighting, I've mentioned some of us like to work on a bed, or you kind of like leaning back on the couch. It kind of creates a posture which may not be conducive to the use of the digital devices. And if you ask whether if any blue light glasses does help, some patients have reported that it does reduce strain, it reduces fatigue. I think there is no harm. If you find that it really helps you, you can go ahead to use it, but it has not been shown to provide any additional benefit other than the cost of the blue light glasses itself. So the other common question which has been asked is, does increased work on digital devices or working from home, has it been shown to increase the rate of developing presbyopia or the need for reading glasses? I think the main answer is that there's no. This presbyopia or the dependence on reading glasses is still an age-related condition. The other second question is, does it increase my short-sightedness, or do I need to get glasses earlier? Also no, but I think the main point is that if you do need to use glasses or reading glasses, using the correct glasses will actually help you by reducing the fatigue and also the strain, so that you can work for a longer duration of time. The other important point is to make sure that you are at the correct distance from your screen or the reading material or your documents. Typically, we will say that around 50 to 60 cm from the screen, depending on the size of the monitor, of course. And then I think the next is whether this increased digital device use for working from home, does it accelerate the cataract formation? So, such as causing any blur vision, glare, halos, or poor night vision. What I want to emphasize here, because my colleague will be speaking on cataract later, what I do want to reassure everyone is that amongst the causes of cataract, the most common cause is still aging and above 60 years old. And as you can see here, amongst the causes, none of it will include any exposure to blue light or digital device use. And I will leave this to for further discussion by my colleague later. I think some of the practical tips I will give all of you is that do take regular breaks. For example, after 20 minutes of work, you can kind of look at distant objects for 20 seconds before returning to your work. The distant objects, I think one of the other common questions we get is, does looking at green objects help? It hasn't been shown that looking at green objects or green color reduce fatigue, but I think more commonly all the environment or the scenery that we look at, because it's kind of at the distance, it does help. As I mentioned before, ergonomics is a very important point. So having a good office setup does help you in the long run. I think investing in a good table, a good monitor screen, a good chair probably will give you better return on investment. And if you need to take regular breaks, sometimes I do recommend patients using a lubricants. I mean, we don't have any specific recommendation for lubricants, but some patients prefer certain brands over other. I think this is kind of up to personal choice. The other common question is whether with the increased use of lubricants, do we get kind of dependence or we have become over-reliant? This has not been shown to be true also. Some patients, they use more because of the increased near work or, with the increased screen time. But it has been shown that with increased digital device use, we tend to blink less, so it does contribute to dryness. And in that sense, I would recommend lubricants if you are planning to work long hours. So for supplements use, there hasn't been supplements to reduce like strain or fatigue. But I think some of the common supplements on the market includes that of like lutein, omega-3 fish oil, or even flaxseed oil. I think some of these supplements are more specific for conditions such as retinal conditions or dry eyes. If you find that it does help you, there's no harm to continue, but I think a balanced, healthy diet it will also do just as well. So with that, that's the end of my talk, and I'll kind of look at the questions to see if I can answer some of the questions. So if you have any questions, please do type it into the chat group here. So one of the questions, like as I mentioned, is the recommendation of lubricants. So as I mentioned, there's no specific recommendation for the lubricant. Some patients do prefer one brand over the other. I think it's really up to the individual. The second question, of course, here is a kind of frequent dab of water. Is it good for fatigued eyes? I think we kind of try to recommend patients not to wash their eyes with water or tap water. Instead, if you find that you want to kind of cool down the eyes, you can either do a warm compress, or some patients, they prefer a kind of a cold compress. That probably will help more. As I mentioned, the lutein supplements are kind of more for specific eye conditions like retinal conditions or age-related macular degeneration. But to be honest, for a patient without any other eye conditions, actually the supplements are optional in this sense. What we do recommend, very common, is for dry eyes, because a lot of patients do suffer from dry eyes, and some patients find that taking omega-3 fish oil or flaxseed oil, it does reduce the amount of dry sensation or discomfort that they experience. So one of the questions here is, how does reading a lot affect my eyes? I think the long hours of reading, make sure you have proper eyewear in terms of the reading corrections, such as reading glasses. I think the long hours of reading, some patients, they tend to blink less with their near work, so that can kind of contribute to dryness. But if you take regular breaks, you use lubricants as and when necessary, making sure that the font size is of an appropriate size for yourself, I think there isn't really a limit. But of course, I think everything is in moderation. The other question I have here is, what is considered as far as a reference to look in the distance object? I think some of the eye associations have recommended something which is more than 20 feet or more than 6 meters is considered distance. So one of the questions that we get here is whether eye exercise, is it important or does it really help? I think some patients, they find that if they close their eyes, they look left and right, or doing certain rotations, they find that it helps them in reducing the fatigue. But there's no really conclusive evidence that that it actually helps. But if you find that it reduces your fatigue because it actually forces you to take a break, then I will definitely, we will not object doing that. So the other question here is similar to using tap water to wash the eyes, such as the use of Optrex. I think Optrex, because it is formulated for irrigation of the eye, but we would not recommend daily usage, because sometimes a regular usage of such solutions can actually kind of affect the tear surface, or rather the superficial layers of tears on the eye itself. It can upset the balance. So using lubricants is still recommended in this aspect. So the other question here is, are there any operations for presbyopia? Currently, for the condition for presbyopia specifically, there are no operations for that. But certain patients, when we perform cataract surgery for them, depending on the target that they prefer, such as correcting for near vision, it can reduce their reliance on reading glasses. On a case-by-case basis, some patients may benefit from laser refractive surgery, but I will remind patients that there's no specific lasers or treatment for presbyopia, and still the most common solution in this case is the use of reading glasses. So for the use of iPad, meaning like a gel pad for compressing the eye, like a warm compress or cold compress, it does help in certain conditions. Some patients, because they have allergic eye conditions, they find that a cold compress does relieve the symptoms. Whereas for some patients, because of their oily eyelids or because of the crusting that they have on their eyes, a warm compress may help. So the other question here is, will frequent use of lubricants cause addiction or reliance such that we become dependent on it? The short answer is no. I think patients, once they use the lubricants, they find that it actually helps them reduce the symptoms, so that they kind of get into like a regular use of the lubricants. So they can of course stop at any time, but it does not cause any addiction or reliance on the lubricants. The other question here is what should be our eye level when we use the computers? I think the recommended position of the monitor is usually slightly just below your eye level, so that you're kind of looking down slightly at the monitor, and it kind of reduces your strain. Also, I think the posture that you adopt when you have this screen slightly lower than your eye level, it's not as uncomfortable. So one of the other questions here is why eye drops have to be discarded after 1 month. I think the eye drops, all of them contain a very small amount of preservative. This is to kind of increase the shelf life, and the recommendation to discard them after 1 month is usually due to the increased risk of kind of growing what we call pathogens or bacteria or contamination from the use of the eye drops itself. So we usually recommend discarding them after 1 month, so that the risk of infections or such as discomfort from using expired eye drops is lower. So I have one question here. To relieve eye strain, is it okay to palm my eyes? I think what this particular question is referring to is kind of when we want to reduce the eye strain, if we kind of put pressure, gentle pressure on the eye or rub the eye, would that be okay? I think generally we will ask patients not to put excessive pressure on the eye per se, and also not to avoid rubbing the eyes. If you want to palm the eye, I think I would more recommend doing like a compress using like a hot towel or even a gel pad. Yeah. So let's see. So I have one question here. When I rotate my eyes, there's some discomfort. Should I continue to do it? I think if there's any particular discomfort or very severe pain when patients move their eyes, I would recommend having an eye check to make sure that there's no other eye problems. But a lot of the patients, because of the increased digital device use, sometimes when they close their eyes, they might get a stinging sensation or a burning sensation for a short duration of time. This is more related to dry eyes. So this is where frequent breaks of the use of lubricants is recommended. And I think with that, my time is up. So thanks for your time in attending this talk.